Peroral endoscopic myotomy, mucosotomy closure with the Retentia clip. In this video, we are performing an esophageal peroral endoscopic myotomy for the treatment of achalasia. During submucosal tunneling, bleeding was encountered. RDI, red dichromatic imaging on the EVIS X1 system, was utilized to clearly localize the bleeding point, and hemostasis was achieved using a coagulation grasper forceps. After completing the myotomy, attention was directed to the mucosotomy, which was closed to minimize the risk of post-procedure leak. A 16mm Retentia clip was advanced through the gastroscope and rotated so the clip jaws were aligned perpendicular to the distal apex of the mucosotomy. Deployment was accomplished in a single step by pulling the slider toward the thumb ring. An additional 4 clips were then placed in a zipper-like fashion to achieve complete closure. The Retentia clip was selected for closure because of its 360-degree rotatability, which enables precise placement, and its short tail. The shorter tail facilitates manipulation in confined spaces such as the esophagus, minimizes obstruction of the endoscopic view during placement, and is less likely to cause mechanical irritation, reducing the risk of post-procedure discomfort, pain, or foreign body sensation compared to longer tail clips.